Dr. Chuck Washington has always had a heart for people who need him the most.
I'm Dr. Washington.
He's an ER doctor here at St. Luke's. But 2 weeks out of the year, he leaves the comforts of this hospital and travels to Thailand to help people a world away. Not the patients, but the healthcare workers, the medics, who are trying to save lives across the border in war-torn Myanmar.
They work in areas where there's no doctors or nurses, and there's really a lack of resources in healthcare facilities. Myanmar has been undergoing a civil war for the last 60 or so years, but they really don't have options besides these medics.
Dr. Washington teaches emergency and trauma medicine to people out on the front lines.
This year, I think it was about 28 medics.
For his most recent trip, he recruited some of his coworkers from St. Luke's, scribe Nick Thompson, nurses Claire Cragen and Ann Wardle, and Dr. Derek Patterson.
The volunteers are paying their own money. They're taking time away from their family and their work. But until you get over there, it's hard to really understand what these medics are doing and how they're doing stuff that, in many cases, I would not feel comfortable doing these kind of procedures in a jungle hut. It's eye-opening.
These brave medics, both men and women, work in what are called the black zones, dangerous areas where doctors and expert medical teams are not allowed.
It's definitely challenging, and it's hard to put people in that environment until they actually get in that environment and see what the medics are dealing with. These medics are working in a place without electricity, without oxygen.
The medical supplies the group brings along are donated by a local group in Boise called Hands of Hope.
Hands of Hope has been supporting us for the last 4 years.
Dr. Washington and his crew poured their hearts into those long days. They know how important this training is.
Either they perform these procedures and take care of these people, or that the person will likely die.
He says that's what keeps him coming back.
I'm happy to use my knowledge and skills to help trying to advance the healthcare system in that region.
Dr. Washington is also a husband and a father, so leaving isn't easy.
I leave my wife, and I have two young kids, so it's a challenge, but it's very rewarding, and it kind of drives me through the year and kind of reemphasizes why I went into medicine in the first place.
He says he'll keep going back as long as he's asked to. He knows he's making a difference. Dr. Chuck Washington.
It's very rewarding to go over.
A hero at home and in a land far away.